Hello everyone, hope the last videos were useful to you. Now this is going to be an interesting video, that's foaling. Let's start from the physical changes that occur before parturition. Vulvar laxity and edema, relaxation of pelvic ligaments, udder enlargement are the main signs of nearing parturition. The most reliable indicator for impending parturition is remarkable change in udder secretion. In the last 2 weeks, you can see apparent change in mammary gland growth. This waxy secretion on TTNs usually occur 1 to 4 days before foaling, but sometimes as early as 2 weeks or not at all. Here you can see a well relaxed sacroischiatic ligaments. So now we are going to see an actual foaling. Even though it is a continuous process, it has been divided into 3 stages. The first stage, or we can call it as preparatory stage, usually requires 30 minutes to 4 hours. Pluriparous mares will not take more time. During the first stage, mare will be restless and exhibit signs similar to that of colic, like pawing, raising the tail, looking at the flank, lying down and getting up, and urinate small quantity frequently. During this time, the intensity and frequency of uterine contraction will be increased and the cervix will start relaxing. So the foal will move towards the birth canal. First the foal's forefeet and muzzle reach the cervix, then chorioallantic membrane ruptures and dark allantoic fluids comes out. Once the chorioallantic membrane ruptures, the second stage of labor starts. In the second stage only the actual foaling occurs. The tail is bandaged and it is better to wash the perineum to avoid ascending infection. Then the mare lies down on her side and starts straining forcefully. White membrane, that is amnion, should come out within 5 minutes after the rupture of chorioallantic membrane. It is good we are seeing white amniotic membrane. There is something called red bag delivery. Instead of white membrane, there will be red membrane comes out of vagina. That is because of premature placental separation and the foal fails to rupture the placenta at cervical stalk. That time we have to be very fast to relieve the foal. In a normal presentation, first one forefoot and then the other become visible. The head will rest on fetlock or carpal joint. During this time, mares may take rest and push. Yeah, now she started pushing vigorously. Usually, delivery of foal occurs within 20 to 30 minutes. If it goes beyond this, veterinary attention is warranted. Almost it is over now. Yes, it's time to act. Open the amniotic membrane and clear the airway passage. After this, umbilical cord. It is better to allow the umbilical cord intact for few minutes or wait until the cessation of pulse in umbilical cord. Naturally, the umbilical cord breaks when the mare stands or the foal attempts to rise. We can break manually also by pulling it carefully without giving excess tension on cord attachment at abdominal wall. Or you can hold the umbilical stump towards abdominal wall and pull the foal away. But never ever cut the umbilical cord, it may result in excessive hemorrhage or patent urachus. We need not to tie or suture the umbilicus unless it bleeds heavily. Antiseptics should be applied to prevent naval infection. What is this? Do you know? This is the hoof of newborn. It will be an amazing transformation from very soft hoof to very hard hoof in adult stage. The third stage of labor is expulsion of fetal membrane and uterine involution. The placenta can be tied to itself to avoid being stepped on it, because if the mare steps over the placenta, placenta may tear and portion of placenta may be retained inside. Placenta is typically expelled within 30 minutes to 3 hours after foaling. If it is not passed by this time, then it is considered as retained placenta. After expulsion, we have to examine the placenta carefully for any retention. Normally, the foal will try to get up within 30 minutes after birth. And within 2 hours, the foal has to stand on its own and drink colostrum. Hope you enjoyed this video. If you find this video useful, please share it with your friends. Please subscribe and turn on the notification button if you don't want to miss out the upcoming videos. Thank you.